Hey guys, welcome to another episode of Let's Get Physical. This is episode 4. Every episode we bring on someone from the public, and they're usually unrelated to the physical therapy field, but we ask them 3 words and we ask them the first thing that comes to their mind. So this time I'm going to interview Ralph. He's a retired pharmacist. He practiced for 32 years, and I'm going to ask him about weightlifting, physical therapy, and pharmacy. Enjoy the show. Today we have Ralph on. He was a pharmacist. He's retired now. Did a lot of years in the industry, over 30, 40?
32 years on the faculty at UOP.
32 years as a faculty. So we're going to get his insight on 3 words today. So as usual, I say 3 words, and he's going to first give me his reaction. So first words that come to mind to it, and then we're going to talk about why he thinks that way with these words. You ready, Ralph? All right. First word is weightlifting.
Weightlifting.
One word.
Oh, I get to say one. Okay. Fitness.
Fitness, okay. Physical therapy.
Fitness.
Okay.
Hip replacement.
Okay. Pharmacy.
Patient care.
I like that one. All right, so let's get right into it. Weightlifting. Why do you say fitness?
Well,
Makes sense.
Yeah, well, weightlifting can lead to fitness.
Yeah.
Since I recently started weightlifting for the first time.
About a year ago, you said, right?
May 18th, 2015, 14 months ago.
Okay.
And my motivation was I lost my mother at 97, who had a stroke. She died in February 2015, but she had a stroke in 2001. So I took care of her from 2003 to 2011, then she was in nursing home. And even with that stroke, she made it to 97. So I came to the conclusion I have her genes since I have her bunions.
Yeah.
So I decided I was going to, even up to this point, the last maybe 10 years, I've been walking a lot.
Yeah.
I decided walking just wasn't going to be enough to protect me for longevity.
Yeah.
And since I know from knowledge that the elderly tend to damage themselves the most when they fall as you get older, I decided I wanted to live to 97, take advantage of those genes. I wanted to lose some weight, and I wanted to build some muscle to protect my bones for the future.
Yeah, and I'd say you have quite a bit of muscle. I mean, this morning we were working out, deadlifting 145, squatting 115. Other day you're benching 40 pounds on dumbbell chest press, right? So I think it's interesting too that you do weightlifting because a lot more people should do it, especially older adults. We were talking about that too. You even told me like, oh man, I would have fallen, maybe a year ago if I hadn't worked out or done any of it. So good on you for doing weightlifting because it does add a lot of benefits to your life and your fitness. As long as you dose it right and you progress it right, I mean, you could weightlift for a really long time, become real strong for a real long time through your life, especially for older adults too. So,
well, one of the main reasons I decided to go with a personal trainer is for all those reasons. I didn't want to do it on my own. I wanted to be pushed, but I also wanted to do it properly. And I've seen so many people not do it properly.
Yeah,
over the years, just watching.
Me too.
But I'm stuck on it. I'm addicted.
Yeah,
I enjoy it. Early on, when I first started, there was a group of Emeriti faculty, which I am retired in 2002, so I've been retired for 13 years.
Yeah,
almost 14 now. And they invited me to go to one of those Monday early morning sessions, group sessions, and I saw what they were doing, and I thought, no, I need personalized. I'm glad I made that decision, and of course the price here is you can't beat it, $18 an hour.
Yeah, the last episode we had Caitlin talk about resource on caffeine. Like students need to utilize everything here, both the free and paid ones. The paid ones are just so cheap. And shout out to your trainer Matt Longus. He's doing awesome. He's over in Spain.
He's taking summer off.
Yeah, and he was with you for the full year, pretty much.
Right? Well, I started with Matt, and then one semester last fall he had to take off because he had a very heavy course load, and he was working with ASUOP at the time. Yeah. So I worked with Sierra Alvarez for a semester, and then Matt took me back, and then through the summer, and then he went to Spain, and I met you, Vien, and I was sort of excited because when told me you were a physical therapy student, that I felt that brought an added dimension to the training, which it has. I think one of the first things you told me you were gonna try to help me with is range of motion.
Yeah.
And I didn't realize how important that is. I mean, I've already noticed the difference.
Only thing is I don't smile. But yeah, I'm working on it.
Yeah, actually, it's just your humor.
I'm just grumpy all the time, you know?
No.
All right, next one, physical therapy. You say fitness, which is very interesting. Why do you say that?
Well, I said fitness first because I just came to my mind, but I also said hip replacements.
Yeah.
And another thing that not everybody knows, I have both hips replaced.
Mm-hmm.
At one point, I think after I had both hips replaced, I gained an inch in height. I mean, I was bent over that much.
Yeah.
And it was I did the right hip in 08, the left hip in 09, and I fortunately had the anterior approach.
Mm-hmm.
I had to go out of Stockton to do it, but because I was caring for my mother and I needed to be able to get. When I got back from the hospital, I went right back into caregiving. I was helping my mother go to the bathroom, go to bed, dress her, and everything.
Yeah.
And I was doing it with a walker for about 15 days, and then I got to a cane. And actually, even less than 15 days. 15 days is when they let me drive the car.
Yeah.
First time. But so I think fitness, and ever since then, I've been able to get back into some form of fitness, mostly walking up until a year ago. And I've never felt better since my hip replacement. I got rid of that pain. I can do things like I couldn't do before. I can bend over and pick up a penny on the ground. Which is nice.
So I like it that you said fitness because a lot of people will say injury rehab, which I mean I don't blame them, but it did help you with injury and rehab, of course. But it also helped you. It gave you the potential of fitness again. Is kind of what I'm getting from what you're saying.
Well, I think again, going back to what I said earlier, you bring to the table something in addition to a personal trainer.
Yeah.
Because you know the body better because of your physical therapy training.
Mm-hmm.
And I remember whenever I had an issue, your stretching was a little bit more focused.
Yeah.
On the specific area, not just the shoulder.
Yeah, and then certain stretching versus strengthening techniques at the right time.
Yeah.
Speeds. I mean, that all plays a factor too. And it's great that you say that because, again, PTs are good at rehab, but overall we're movement specialists. So Kaylin, I mean, she's hiring Helen, who's also a PT student, and then also I think about 3 more want to come on board. So it's looking good for the gym here too. So it gives us a chance to like educate the public on that because I'm sure you probably like, oh, he probably will make sure I don't get hurt, or if I do, he'll help. But also just little. I mean, I'm nitpicking.
Well, stuff too, what you didn't finish explaining. I walk a lot still. Yeah. And the streets in Stockton, a lot of the sidewalks are breaks, and before every so often, maybe once every 3 or 4 months, I'll catch my toe.
Yeah,
I'm either listening to a book when I'm walking or not concentrating, and I used to fall.
Yeah,
I mean, I literally end up skinning my palms.
Yeah,
the last couple of times I tripped up, I was able to say I never hit the ground.
Yeah,
and I really believe a lot of it has to do with my training. Workouts.
And you can jump rope now.
Oh yeah,
that video is going on the website, How Fit Works, so you should check that out. Okay, and then last one is pharmacy, and you said patient care.
Yeah, that's an easy one. Since I've been around the pharmacy world, I practiced for 6 years as a community pharmacist, an independent community pharmacist, and then I was offered the job at Pacific in 1970 as the first director of student affairs and first internship coordinator. And these were 2 jobs I'd never done before. I had a bachelor's of science in pharmacy, and that was it.
Yeah.
But I knew I liked working with people, so students. I took the opportunity, and I worked with the students over the years. And one of the pharmacists are extremely well educated in patient care, but the roles have expanded slowly.
Yeah.
But in California recently, about 2 years ago, we passed a provider status bill, and now it's going nationwide. Mm-hmm. But right now, California is one of maybe 15 states, maybe less than that, have patient provider status, where pharmacists can do more than just fill prescriptions.
Yeah. So
in the future of the profession, with the Affordable Care Act and other expansion of healthcare, pharmacists can play a major role in patient care. And you have to think of the patient as a total person.
Yeah.
Oftentimes, you fill a prescription for type 2 diabetic, but what we really should be doing is encouraging them to lose weight, work out, do the things that you could reverse it.
Yeah.
Because you can literally reverse a lot of conditions. Unfortunately, our healthcare system is based on treating symptoms, not disease.
Yeah.
As a group, and I think pharmacists are in a good role that they can, along with working with physicians. And
I think, and from my perspective, especially, we had Dr. Rogan teaches for pharmacy, and a lot of people think it's either you're on the camp where they believe in patients be on drugs or patients be on exercise. But I always saw it, and it reinforces it now too about what UOP teaches pharmacists is you're treating the symptoms, but it's important because those symptoms need to be treated before they can actually get to fitness and even get on board with it. So it's like you said, it's real important to give them the drugs, but also say, okay,
unfortunately, the pharmaceutical industry, I hate to point to a bad guy, but I mean, their role is to sell their drugs.
Yeah.
And so they promote treating symptoms.
Yeah.
And the doctors, oftentimes, it's quick and easy to treat symptoms by just giving them a drug. But oftentimes, you can correct the condition by just proper eating and proper nutrition and exercise.
Yeah.
And if you, and the worst thing can happen to you if you become a diabetic, you'll end up having your legs amputated or your limbs amputated, and I think there's a better way if you want to live long to take care of yourself. Sometimes, if a pharmacist isn't relying on filling a prescription to get paid, which is what's starting to happen now, we're able to get paid for providing knowledge rather than just drugs.
Yeah,
there'll be a real incentive to try to help people stay well.
Yeah, well, it works out even with those drug companies going for that kind of bottom line money. It works because pharmacists and PTs, we get to be the middlemen between that, and we also interact with patients on those drugs. So it gives us a chance every time.
I mean, there are conditions where you need medication if you have a heart condition, or you have to have blood thinners if you've had a stroke.
Yeah. But
I remember when my mother lived with me, and she had fallen and had an intertrochanteric fracture. Mm-hmm. Took me a while to figure out how to say that. And she was on, at the hospital, they put her on so many different medications. And before she moved out of my house to the nursing home, I got her off everything except two. One was cumin. And the other was stool softener.